Odds are you know someone with an eating disorder. Nearly 29 million Americans struggle with one in their lifetime, according to the National Eating Disorders Association.
That's why healthcare organizations across Maine are coming together to spread awareness about a disease that often goes unnoticed. News Center Maine's Drew Peters spoke with eating disorder experts and with a Mainer who is now in recovery to learn more.
It truly is a different person than the self that you normally are.
For months, Adelaide Valley knew something was off with her body.
All I could think about was what food I was going to eat, what food I wasn't going to eat. I was angry all the time. I would lash out.
But no matter how much her diet hurt her, she always tried to hide it from her family and friends.
It took everyone around me, a total team effort, to sound the alarm and say, hey, something is wrong.
Now in full recovery after years of treatment, Valley is joining several healthcare organizations across Maine in a week of spreading awareness about eating disorders and their impacts.
Anyone could have an eating disorder and we may not know it just by looking at them.
Sarah Porter with the Northern Light Acadia Hospital in Bangor says the secrecy and subtleness surrounding eating disorders make them difficult to diagnose. But there are a few patterns to watch out for.
Mood changes, they notice a difference in how, their child or loved one is talking about their body, if they're avoiding meal times.
While women are most frequently diagnosed, Amy Grimm with Kaleidoscope Eating Disorders and Diet Recovery Center in Yarmouth says eating disorders impact everyone.
Men and women and older people. And, we have clients as young as 7, 8, 9.
According to Grimm and Porter, disorders like anorexia, bulimia, and binge eating not only harm a person's physical health,
stomach issues, GI problems, anemia and vitamin deficiencies,
but their mental health as well.
Anxiety, obsessive compulsive behaviors, significant depression.
With proper treatment from dietitians and specialists at places like Kaleidoscope and Northern Light Acadia, though,
ensure that they're getting the nutrition, they're being monitored by their primary care physician.
Both experts and Valley say recovery is always possible.
You can choose recovery, you can choose the better path, but in order to do that, you need a good team behind you who will fight for you every step of the way.
In Bangor, Drew Peters, News Center, Maine.
Eating disorder experts say early detection is one of the most important keys to successful long-term recovery. If you or anyone you know is struggling or think they might be struggling with an eating disorder, you can contact the Northern Light Acadia Hospital or Kaleidoscope Eating Disorders and Diet Recovery Center. Links for both of those can be found on our website.